Welcome to Easy Anatomy. We're gonna discuss now pharyngeal muscles. When we talk about pharyngeal muscles, keep in mind that we have 6 muscles in each side. So on each side we have 6 muscles. Okay, 3 circular and 3 longitudinal muscles. Okay. So the 3 circular muscles are constrictor muscles, superior, middle, and inferior constrictors. The 3 longitudinal muscles are 1. Salpingio, pharyngeus muscle. 2. Palato-pharyngeus muscle. 3. Stylopharyngeus muscle. Okay, so we have 3 circular and 3 longitudinal muscles on each side of the pharynx: the constrictor, salpingio, palato, and stylopharyngeus muscles. Okay, keep in mind that all pharyngeal muscles are supplied by vagus nerve through pharyngeal plexus. Okay, pharyngeal plexus of nerves, except which muscle? Except stylopharyngeus muscle. The stylopharyngeus muscle is going to be supplied by glossopharyngeal nerve, by glossopharyngeal, cranial nerve number 9. Okay, and this is the only muscle supplied by glossopharyngeal nerve. So if I ask you which muscles of the pharynx supplied by glossopharyngeal, it's the stylopharyngeus, and which is the only muscle supplied by glossopharyngeal nerve is going to be stylopharyngeus muscle. Okay, the rest of the muscles supplied by cranial nerve number 10, which is vagus. Okay, second, those are facts. Fact number 2, pharyngeal muscles important for swallowing. Okay, they are important for swallowing, moving pharynx during swallowing. Okay, and the longitudinal muscle assist elevation of larynx during swallowing. Why? Because longitudinal muscles, the 3 longitudinal muscles are going to attach to the lateral wall of the pharynx, also posterior border of thyroid cartilage. And the thyroid cartilage, as you know, is part of the larynx. So again, keep in mind that the 3 muscles, the longitudinal muscles, are inserted into thyroid cartilage, posterior border of thyroid cartilage. Okay, that's why these 3 muscles, in addition to assisting pharynx to move during swallowing, also assist in elevation of the larynx during swallowing, because they inserted into thyroid cartilage. Okay, let us look at the attachment of pharyngeal muscles. Very easy, and they are easy to be remembered if we follow this kind of diagram. So we start with the constrictor muscles or pharyngeal muscles as a whole. Again, we have from the base of the skull, this is the base of the skull, base of skull, there is pharyngeal tubercle in front of the foramen magnum. It's called the pharyngeal tubercle anterior to the foramen magnum. So this pharyngeal tubercle, there is median fibrous band extend from the base of the skull through the neck. This is represents the insertion of all constrictor muscles. So the constrictor muscle from right and left side, they inserted into this median fibrous tissue. Okay. Then superior constrictor, middle and inferior, they look like fan, narrow origin, wide insertion. Let us see how they look like. So remember, here is the base of the skull, and if you remember, there is part of sphenoid bone called the pterygoid process and the pterygoid humulus. Okay, then this is the posterior, this is the mylohyoid line, and here is the posterior end of the mylohyoid line. There is a ligament. This ligament is called trigomandibular ligament. Trigomandibular ligament. So we have trigomandibular, this is mylohyoid line of the mandible. This is pterygoid process, medial pterygoid plate, pterygoid process, and this is the base of the skull. Base of the skull. Keep in mind that this is base of a skull. What is this ligament again? Trigomandibular ligament. This is the mylohyoid line. So the superior constrictor muscle take origin from this structure, from the pterygoid process, from trigomandibular ligament, okay, and the posterior end of mylohyoid line, and the posterior end of mylohyoid line. This is the origin. Narrow origin, wide insertion. So the origin again, pterygoid process, trigomandibular ligament, and the posterior end of mylohyoid line. This is the superior constrictor muscle. What is the insertion again? This is a pharyngeal fibrous tissue in the posterior end or the posterior part of the pharynx, extended from pharyngeal tubercle through the neck. Okay, second muscle. Remember, this is a mandible. What is the name of the bone here? Is going to be hyoid bone. Hyoid bone has lesser horn and the greater horn on each side, correct? Greater and lesser. The second muscle, which is middle constrictor muscle, take origin from the lesser and greater horn of hyoid bone. Lesser and greater horn of the hyoid bone. Okay. This is middle constrictor muscle. Middle constrictor muscle. Take origin from hyoid bone. What is the skeleton here in this area? Just below hyoid bone, thyroid cartilage. So you have thyroid cartilage, correct? The thyroid cartilage, if you remember, has oblique line on the side. It's like two lamina, and here is the oblique line. This oblique line give attachment to three muscles. This is thyroid cartilage. Thyroid cartilage. Then blue here you have cricoid cartilage. Cricoid cartilage. Okay. Inferior constrictor muscle has unique origin because it has two portions. One from thyroid, we call it stylopharyngeus muscle. Sometimes we give this part this name, stylopharyngeus muscle. Then you have cricoid portion. Okay, this cricoid portion we call it cricopharyngeus muscle. Cricopharyngeus muscle. So both of them, they form an inferior constrictor. So this one here, inferior constrictor, and it has two parts. This part is called stylopharyngeus muscle, and this one cricopharyngeus muscle. Okay. Keep in mind that this oblique line of the thyroid cartilage give attachment to another two muscles. Up here, this is thyroid muscle. Down here, sternothyroid muscle. So if I ask you what are muscles connected to the thyroid cartilage to the oblique line, three muscles. You have because which bone is here in this area? Manubrium or sternum? This area you have sternum, correct? So this one is called sternothyroid. This is thyroid muscle. Okay. So the oblique line of thyroid cartilage give attachment to three muscles: thyroid, this one, sternothyroid, that one, and inferior constrictor muscle. So the constrictor muscles, now they contract to push food down. However, cricopharyngeus muscle usually relax to receive this food, then pushing it down to the esophagus. Okay, so let us see the shape of these muscles, the shape of the origin, narrow origin wide insertion, create gaps between those muscles. Here is a gap between superior constrictor and the base of the skull. There is a gap between superior and the middle. There is a gap between middle and the inferior. There is a gap under the inferior constrictor. There are very important structures located in these gaps. I will start with this gap here between the base of the skull and superior constrictor. What you can find here, what you can find in this gap. First, you will see eustachian tube opening, the opening of eustachian tube. So this is eustachian tube opening. Second, facial artery will ascend superficial here to the superior constrictor before hiding under the mandible and then ascend to the face. In this area, facial artery is going to send ascending palatine artery, which appear in this gap, ascending palatine. So this is facial artery. Okay, and this is the ascending branch of facial artery. Ascending palatine branch. Ascending palatine artery. Okay, branch from fascia. Then keep in mind there are muscles which are connected to the eustachian tube here. This muscle is going to be what? Tensor palatine and elevator palatine muscles. The tensor palatine and elevator palatine muscle. So keep in mind that there is muscles here which are connected here and is going to trigode hamulus, turn around it before going to the palate. This is tensor palatine, and also there is elevator palatine muscle. So at least you remember now that there are 3 to 4 structures located in this area. So this is tensor palatine muscle. This is ascending palatine. This is eustachian tube. Okay, so if I ask you what is located between the base of the skull and superior constrictor, you have muscle, you have tube, you have an artery. So how about this gap between superior and the middle constrictor? Between superior and middle constrictor. This gap, you will see important nerve going to the tongue and the pharynx. This nerve is what? Glossopharyngeal nerve, number 9. And the only muscle supplied by this nerve, you will see it behind it. This muscle is going to be stylopharyngeus muscle. Stylopharyngeus muscle, which descend like this on the inner surface of the constrictor muscle until it reaches to the thyroid cartilage. So this is stylopharyngeus muscle. Okay? Stylopharyngeus muscle. Then there is a ligament. This ligament is called stylohyoid ligament, going to the hyoid bone. This ligament is what? Stylohyoid ligament. This is the stylohyoid ligament. Okay. So those are the three structures in the gap between superior and middle constrictor. So we have three structures here, 3 or more if we add levator palatine. We have three structures here in this gap: stylohyoid ligament, glossopharyngeal nerve, and stylopharyngeus muscle. Those are the three structures in the gap between superior and middle. What is located here in the middle, between middle and inferior? You see, this is hyoid bone and this thyroid cartilage. There is a ligament here. This ligament is called, which extend here. This ligament is called thyrohyoid ligament, thyrohyoid membrane or ligament. The midline, in the midline, become very thick. We call it ligament, but at the lateral side, we call it membrane. So thyrohyoid membrane. This thyrohyoid membrane is going to be penetrated by nerve and artery. The nerve is a branch from vagus. It's called internal laryngeal nerve. It's called what? Internal laryngeal nerve. The artery is going to be a branch from superior thyroid artery. It's called superior laryngeal artery. Superior laryngeal artery. So this artery coming from where? From superior thyroid. This nerve coming from where? Coming from vagus. So the origin of this nerve is vagus. The origin of this artery is superior thyroid artery. The name of this artery is what? Superior laryngeal artery. Superior laryngeal artery. This one is called internal laryngeal nerve, which carries sensation from the upper half of the larynx. Internal laryngeal nerve, a branch from vagus, carries sensation from the upper half of the larynx. And the superior laryngeal artery is a branch from superior thyroid artery, supplying also upper half of the larynx. Okay, the last part or last gap is located under inferior constrictor muscle here, in which you can see here is the vagus nerve. Vagus nerve is going to send this branch before getting into the thorax. This branch is called what? Recurrent laryngeal nerve. So this is the vagus, number 10, vagus, number 10, okay? Remember that we are looking at the inner surface now, or medial surface of the pharynx. So the vagus located in the carotid sheath, lateral from outside. So vagus descend out laterally, then sending this recurrent laryngeal nerve. If superior thyroid artery send superior laryngeal branch, you will see that inferior thyroid artery, which is coming from subclavian artery, this is subclavian artery, at the root of the neck is going to send inferior thyroid artery, which is going to send a branch is called inferior laryngeal. Called what? Inferior laryngeal artery. So this is inferior thyroid artery, and descending inferior laryngeal artery. You have superior laryngeal, you have inferior laryngeal. Superior laryngeal side by side with the internal laryngeal nerve, branch from vagus. Here is recurrent laryngeal nerve, a branch from vagus also, accompanied by internal laryngeal, inferior laryngeal artery. Inferior laryngeal artery. Okay. Nerve supply of the constrictor, as I mentioned, they are supplied by pharyngeal plexus, and the pharyngeal plexus is a motor root of pharyngeal plexus is vagus. Okay. However, keep in mind that this portion of inferior constrictor, which you call the cricopharyngeus muscle, also receive another nerve supply from external laryngeal nerve. The external laryngeal nerve, remember, the primary muscle supplied by it is called what? Cricothyroid muscle. So external laryngeal nerve, which is still a branch from vagus, supply cricopharyngeus and they supplies cricothyroid muscle. Okay? So basically, the inferior constrictor receives two nerves, one from pharyngeal plexus and one from external laryngeal nerve. How about the three longitudinal muscles? As I mentioned, there is one coming from eustachian tube here. It's called salpingopharyngeus muscle. Descend like this at the inner surface of the constrictor. It's called salpingopharyngeus muscle. Then there is another muscle coming from the palate. If you can imagine the soft palate here or the uvula located here in this area. Okay, so from there, from the palate, you will see, here is the palate, you can see another muscles coming from here. This muscle is going to be what? Palatopharyngeus muscle. Then you have stylopharyngeus. All of them are going to connected or attached together and then connected to the thyroid cartilage. Those are the three longitudinal muscles. This one, stylopharyngeus muscle, from styloid process and appears here in the gap between superior and the middle constrictor. This one, palatopharyngeus muscle coming from the palate, and that one, salpingopharyngeus muscle coming from eustachian tube. Okay, and all of them joining each other before the insertion into the posterior border of thyroid cartilage. Okay. This was a summary for pharyngeal muscles, 6 muscles on each side. So before I close, I need from you to remember that all of them supplied by pharyngeal plexus of nerves, which is located on the surface of middle constrictor muscle, the motor root of pharyngeal plexus coming from vagus. The only muscle is not supplied by that plexus or by that vagus is stylopharyngeus, supplied by glossopharyngeal. And inferior constrictor receive from nerve supply from vagus and either through pharyngeal plexus in addition to external laryngeal nerve, and the external laryngeal nerve supplying the lower portion, which is cricopharyngeus muscle. So movement produced by pharyngeal muscles, there is direct movement on the pharynx during swallowing and also movement of the larynx through these 3 longitudinal muscles which are inserted into thyroid cartilage, elevating larynx during swallowing. Thank you.